I'm student pharmacist Ryan Petros, and with me are my colleagues Alina Moeen, Dia Cabrera, and Michael Yang. We will be discussing the disease state of human immunodeficiency virus, along with possible treatment methods. Human immunodeficiency virus, or HIV for short, is a virus that can be transmitted through the contact of an infected individual's blood, semen, or vaginal fluids. The virus is unique because its progression leads to a condition known commonly as AIDS. To begin, signs and symptoms do not appear until approximately 2 to 4 weeks after infection and can last anywhere from a few days to several weeks. Common symptoms associated with this condition are fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. However, these symptoms are not exclusive to only HIV. There are 3 stages associated with HIV. The first stage is called acute HIV infection. During this stage, large amounts of the virus circulate the blood, which also indicates that a person is highly contagious. There may or may not be symptoms associated with this stage, which is why medical professionals advise patients that are believed to be infected to seek medical care. There are 2 acute infection tests that a person may be given. The first test is the antigen antibody test, and the second is the nucleic acid test.
After the acute HIV stage comes stage 2, the chronic HIV infection stage, also known as the stage with no symptoms. During this stage, HIV is still in the body, but many people don't show any signs of being sick. But if you don't take medication to control the infection, the disease may progress faster and last longer. People with HIV at this stage can still spread the disease. When symptoms start appearing, the disease has now entered stage 3, and at this point, the infected person has lowered immunity. Stage 3 is known as the acquired immunodeficiency syndrome, or better yet known as AIDS. AIDS is the most severe part of HIV. People with AIDS have badly damaged immune systems, making them highly susceptible to illnesses. People with AIDS can be extremely infectious, and without treatment, they typically live to about 3 years.
Truvada is a FDA-approved drug that is used before exposure to stop the cells in your body from getting infected by HIV. The generic name for Truvada is emtricitabine, or FTC, and tenofovir disoproxil or TDF. This drug is taken by those who have condom sex with a partner with HIV, have condom sex with a partner with unknown HIV status, and those that share needles. The recommended dose for unaffected adults and teenagers who are at least 77 pounds is 1 tablet containing 200 milligrams of FTC and 300 milligrams of TDF, which is taken orally by mouth daily with or without food. The common side effects are stomach pain, decrease in weight, and headache. The mechanism of Truvada is as follows. When the cells in your body gets infected by HIV, it will want to take control of the cell and forces it to make more copy of it. Once the tablet is in your body, both of the 2 medications will be released. They will work together to interfere with the enzyme called reverse transcriptase, which is used by the HIV-infected cells to make new viruses. By stopping the virus from replicating, Truvada is preventing the virus from making more copies of itself in the body.
Biktarvy is another example of a drug that is used to treat HIV. It is similar to Truvada. However, there are key differences. While Truvada has 2 components, Biktarvy actually has 3. 50 milligrams of bictegravir, 200 milligrams of emtricitabine, and 25 milligrams of tenofovir alafenamide. Just like Truvada, emtricitabine and tenofovir work together to inhibit the action of reverse transcriptase and prevents the virus from producing viral DNA. However, there is an additional component in Biktarvy that makes this drug especially effective in patients who have already been exposed or are infected with HIV. This component, bictegravir, acts on the enzyme integrase, which the virus uses to integrate its viral DNA into the human DNA. Biktarvy is taken by mouth every day at any time of the day, with or without food. Some common side effects you may experience while taking Biktarvy include diarrhea, nausea, and headache. However, if you take Biktarvy as prescribed, you can get the levels of HIV in your blood to undetectable levels and lead a normal, healthy life.